And with me now is Dr. Chris DeRienzo, Chief Medical Officer of WakeMed. Chris, thanks for taking the time today.
I'm really happy to be here, David.
So how common are you seeing cases like this, serious cases like Martin Taylor?
Well, certainly, I'm incredibly grateful to see the total number of cases dropping. We hit our peak here at WakeMed back in the middle of January at about 184 patients in the middle of a day. We're now down to 39. So that's almost an 80% drop. That said, we're still seeing about 1 in 4 of our patients needing ICU care. So there still are a lot of patients like Mr. Taylor trying to battle this terrible disease.
And from a statewide perspective, we saw this week COVID-19 hospitalizations dip below 1,000 for the first time since October. What does that mean to you?
We've certainly felt it here at WakeMed in the Triangle and across the state. I think Dr. Cohen spoke last week on the program about the leveling that we've seen nationwide. So far in North Carolina, we had a pretty dramatic drop from end of January through mid-February. It hasn't totally flattened out for us yet. We still see the number of hospitalizations decreasing week over week, but certainly remain concerned about the potential danger of this virus. We've seen what it can do through the really dark days of January.
And what do you attribute to the decrease that you're seeing? Is the vaccine making that much of an impact?
Nothing in life is certain, but I'm hard-pressed to say that the vaccine isn't having a dramatic impact. When we look at who is no longer in our hospitals, back on that peak day, January 24th, we had 66 people in house who were over the age of 75. When I got my morning snapshot this morning, that number was down to 3. A 95% reduction in the inpatient census for people over 75. We know those folks were in group 2, they were early to vaccination. And so I've got to believe that we're having a really significant impact on those at highest risk of severe disease, hospitalization, and death.
And you had mentioned earlier, still a little bit of concern. We're seeing what's going on in Europe, other parts of the world. How worried are you about another spike?
But I think just like Dr. Fauci noted, I remain concerned about more spikes in cases. Where I'm beginning to get it increasingly both grateful for the vaccine rollout and believe that we're making progress on are those who are at highest risk of hospitalization and death. The vaccination rollout in the state, I think, is something that our citizens, our providers, our state government, everybody can be proud of. We've led the nation in a number of metrics, especially getting to those who are in that 65 and older category. And the more we build a moat around those at highest risk of severe disease, the better we'll be able to weather whatever dips and valleys are to come in the next few months.
And we reported a few months back about the stress and burden that many frontline workers are facing while fighting this virus. Are nurses and doctors still feeling that?
No question. Even though we've been able to decrease the number of areas within the hospitals where we care for COVID patients, there are still, COVID cohort units that's what they've been doing now for a year without stop. And the level of intensity that they need to bring to bear every single day to provide the level of care we now know through science and experience will give our patients the best chance of survival requires intense effort. We've worked really hard to support those folks, but I know, David, that what they really appreciate is the caring from within our community. And that expression has meant so much to them and to us as WakeMed throughout the past year.
And real briefly, Chris, what's necessary? What do we need to do in order to continue to have these hospitalization numbers go down?
I think as others have spoke to better than me, we can't spike the football yet. But we're this close to the end zone. We're rolling into group 4 this week. Those are folks who are living in congregate settings, those who are homeless, those who have a high risk condition. There's something like 4 million people within that group. We know vaccine supply is rising fast. And so we've got to keep the push over the next 12 to 16 weeks if we want to return to something resembling a normal summertime. I am confident, David, that we can get there. We've just got to keep up the efforts that we've seen through evidence work to keep the spread at bay.
Chris, thank you for your time. Appreciate all your work on this front.
It's really been a pleasure. Thanks for having me on the program.